Hey, Scott from Life Strength Physical Therapy here. Wanted to talk to you today about a couple of patients that have come in to see me recently complaining of shoulder pain. But interestingly, they kind of pointed to here for their shoulder pain. So both patients came in saying that they had persistent shoulder pain that was here out to the shoulder. One of them actually had symptoms that went all the way down her arm, beyond her elbow, into her wrist and hand. She did not complain of numbness or tingling, but she just noticed that she was aching all the way down here. Now, when someone comes in complaining of shoulder pain, we have to kind of tease out whether it's truly the shoulder that's generating that pain, or in these two cases, both were actually having symptoms that were a little closer to the center and down along the inside of that shoulder blade. That often indicates that the neck is involved, and the neck is actually referring this pain out into the arm or into the shoulder blade. Now, referring the pain or radiating the pain out into the arm is kind of a different presentation. It doesn't mean that we necessarily have a shoulder problem. It definitely means that we have something that's irritated here in the neck. The way that we can test this kind of easily, and you can do this on your own, is just to test different positions in your neck. So you would just roll your head forward, see if that changes your symptoms into your shoulder or shoulder blade, or down into the arm in the case of this woman who had the pain down there. Then you can test with your head looking up toward the ceiling, looking over each shoulder, and also tipping your head in each direction. Now, what you're going to do is actually pay attention to what effect that has on your symptoms. It will only do one of three things. It either increases your pain, decreases your pain or symptom, or it has no effect whatsoever. Now, if it has no effect on your symptom, that just means that that's not really taxing it. But the better information is if it worsens or it improves the symptom. Now, if it worsens your symptom, that gives you information on positions to avoid. So you want to actually move away from the symptoms in order to reduce the irritation on the neck. If you find a position that actually reduces the symptom that's going out into your arm or shoulder blade, then that is a position that you want to actually exaggerate or use more frequently through the day. So you might find that dipping away from the sore shoulder actually reduces your pain. So next time you're on the phone, hold it over here and tip your head a little bit that way to see if you can turn that pain off. Now, the radiating pain is kind of a different sort of thing. It doesn't mean that we actually have any sort of damage or tissue irritation out here. It means that we actually have some irritation that's up in the neck. Now, I like to use the analogy of your neck talking with you about your pain. Now, as we speak, we can kind of speak in three different levels. We can whisper, we can talk in a conversational tone, or we can yell. Now, each volume actually allows the sound to travel further. So if we're whispering, you have to be pretty close to the person to be able to hear that. If your neck pain is whispering to you, it's really only going to be here in the neck. If your neck pain is talking with you, in other words, it's getting a little bit louder, it wants to be noticed, that's when we might notice that pain or that symptom coming out to the shoulder, down into the shoulder blade. When your neck is yelling at you, you get pain that comes down below the elbow into the wrist and hand. Our goal with positioning the neck is actually to get it back to whispering to us. We don't want it screaming at us and telling us that we have pain all the way out here. We want it to quiet back down, calm back down, no longer scream at us. So if you can position into a place where you take some of those symptoms away, what you're actually doing is calming down the neck. And then the neck starts talking with you, or better yet, it starts whispering to you. The trick to that is to use those positions more frequently. The more frequently you're in that position that calms the neck down, the less irritable your neck is. And the less irritable that becomes, the less pain you will have going out into the periphery or into the wrist and hand. So again, this actually gives you kind of a little tip to address some of these symptoms that you may be feeling, especially as you're returning to work, working in that new setting at work where we've been used to working at home. So if you find that you're having some of these symptoms coming on, that knot on the top of the shoulder blade that you just always want to rub, Try the neck position test. See if you can turn off some of that pain. If you can, use the position that turns off that pain a lot more frequently. Maybe you can actually prevent from having the pain in the first place and don't even need to worry about getting anything treated. You just need to be more aware of what postures you're in. I hope this tip helps. Hope you have a great day. I'll talk with you soon.